Doctors and nurses across Kent, Surrey and Sussex are leading the way in improving the quality of care for their patients through an innovative programme called Enhancing Quality, or EQ for short. Using the best available knowledge, clinical teams have drawn up a list of actions, which, when taken, are proven to improve patient outcomes for common conditions like heart failure, heart attack, pneumonia, hip and knee surgery, dementia and acute kidney injury. Doctors and nurses are then held to account for the consistency of care they are providing against these high standards. Teams then pinpoint where the care they are providing needs improvement within their organisations and take the necessary action. EQ brings together clinical teams from across the region to compare the care they are providing against the best performers in this region and beyond, including hospitals in the United States. Teams work to resolve issues and share the most effective ways of caring for patients, including care for long-term conditions that involve transfer of care between hospital doctors and nurses and clinical teams outside hospital. This means that more patients than ever before are now receiving the best possible care, and this will lead to measurable improvements in patient outcomes and patient experience.
The Enhancing Quality programme is important because it takes common medical conditions and it tries to ensure that whether you come to the hospital in the week or at the weekend or during the day or the night, you will get the same high quality, evidence-based treatment where nothing is left to chance and your outcome is as good as it can possibly be.
It's important in any job that you get things right all or at least most of the time. In medicine, it's vital that you get them right all the time. And what the programme is doing is giving patients confidence that things are right every time.
Pneumonia is a serious infection of the lung which can make people very ill. It is surprisingly common. Between 80 to 100 patients are admitted every month to this hospital with pneumonia. Between 25 to 30% of them will not survive to leave hospital. But with optimum medical care we can improve on that, and the EQ pathway is helping us deliver best care.
The EQ programme works on several levels. I think the improvement it has is it's a generic thing in the way you handle patients. It makes you identify them earlier, it makes you more proactive in starting treatment and looking after them. And I think fundamentally and importantly it also improves the communication between hospital and community when the patient is discharged. And put together, those are the things that make heart failure care better for patients.
Most of the patients that I talk to are finding real benefits from having a formalised care plan which details how their conditions are going to be managed, but also they're coming out from hospital with a lot more information and are better prepared for the challenges in front of them.
Everybody will know somebody who's been diagnosed with dementia, whether it be a family member, a friend, a relative. The thing about the EQ programme is that it really gives us an opportunity for the first time ever to look at how we collect some of the data around dementia care, both through looking at our numbers coming through to the service for diagnosis, but also around the quality of care.
Being clinical director for EQ has been a tremendous advantage to me in that I now look for variation in practice. Everybody comes to work trying to do their best, every doctor, every nurse, but to have a framework whereby I know that if I do those 5 things or those 7 things, that the outcome for my patients will be better is very reassuring.